Hemorrhoids are a common health concern that affects millions of people. They are swollen blood vessels located in the lower rectum and anus. Imagine these blood vessels as tiny cushions that help with bowel control. Increased pressure can inflame these cushions, causing discomfort and other symptoms. Hemorrhoids are incredibly common, affecting many people, especially those over 50. Many hesitate to seek help due to embarrassment. Factors include straining during bowel movements, prolonged sitting, pregnancy, obesity, and a low-fiber diet. Hemorrhoids can manifest with a range of symptoms, and the severity can vary from person to person. One of the most common symptoms is bright red blood on toilet paper or in the toilet bowl after a bowel movement. While this bleeding is usually painless, it can be alarming and should never be ignored. Another telltale sign is itching or irritation around the anus. This discomfort arises from the inflammation of the hemorrhoids and can range from mild to severe. In some cases, individuals may experience a feeling of fullness or pressure in the rectal area, particularly after a bowel movement. Protruding hemorrhoids, also known as prolapsed hemorrhoids, are another symptom that can cause significant discomfort. These are internal hemorrhoids that have swollen to the point of protruding outside the anus. They may appear as soft, grape-like lumps and can be painful, especially during bowel movements. Pain during bowel movements is another common symptom, particularly with external hemorrhoids, which are located under the skin around the anus. These hemorrhoids are more likely to cause pain because they have more nerve endings than internal hemorrhoids. Diagnosing hemorrhoids typically involves a physical examination and a review of the individual's medical history. The doctor will inquire about symptoms, including the duration and severity. During the exam, the doctor will inspect the anal area for abnormalities. In some cases, a digital rectal exam may be performed. This involves inserting a lubricated, gloved finger into the rectum. For suspected internal hemorrhoids, an anoscopy may be recommended. An anoscope is a tube with a light to visualize the rectum and anal canal. Consult a healthcare professional for a proper diagnosis. Section 4. Conservative Management, Finding Relief at Home. For many individuals, hemorrhoids can be effectively managed with conservative treatment options that focus on relieving symptoms and preventing further irritation. One of the cornerstones of conservative management is increasing fiber intake. Fiber adds bulk to stool, making it softer and easier to pass, which reduces straining during bowel movements. Aim to consume 25 to 30 grams of fiber daily through a combination of fiber-rich foods and supplements if needed. Excellent sources of fiber include fruits, vegetables, legumes, and whole grains. Staying adequately hydrated is equally important, as it helps soften stools and promotes regular bowel movements. Over-the-counter topical creams and ointments can provide soothing relief from itching, discomfort, and swelling. Look for products containing hydrocortisone, witch hazel, or lidocaine, as these ingredients have anti-inflammatory and anesthetic properties. Sitz baths, which involves soaking the anal area in warm water for 10 to 15 minutes several times a day, can also be incredibly soothing. The warm water helps relax the anal sphincter and reduce inflammation, providing temporary relief from discomfort. Section 5. Medical interventions when home remedies aren't enough. When conservative management methods prove ineffective or if hemorrhoids are severe, medical interventions may be necessary to provide lasting relief. Rubber band ligation is a commonly performed outpatient procedure for internal hemorrhoids. During this procedure, a small rubber band is placed around the base of the hemorrhoid, cutting off its blood supply. Over time, the hemorrhoid shrinks and falls off. Sclerotherapy is another minimally invasive option that involves injecting a chemical solution into the hemorrhoid, causing it to shrink. This procedure is generally well tolerated and can be performed in a doctor's office. In more severe cases, or when other treatments have failed, a hemorrhoidectomy may be recommended. This surgical procedure involves removing the hemorrhoids. While highly effective, hemorrhoidectomy is a more invasive procedure that requires a longer recovery period. The choice of medical intervention depends on the severity of the hemorrhoids, the individual's overall health, and their preference. Discussing the risks and benefits of each option with a healthcare professional is crucial to make an informed decision. Section 6. Preventing hemorrhoids, taking charge of your health. While not all cases of hemorrhoids are preventable, adopting certain lifestyle modifications can significantly reduce the risk of developing them. One of the most effective preventive measures is to maintain a healthy weight. Excess weight puts pressure on the veins in the pelvic and rectal area, increasing the likelihood of hemorrhoid formation. Regular exercise is another crucial aspect of hemorrhoid prevention. Exercise promotes healthy bowel function, reduces straining during bowel movements, and helps maintain a healthy weight. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Staying adequately hydrated is essential for maintaining soft stools and preventing constipation, a common contributor to hemorrhoids. Drink plenty of water throughout the day, and consider incorporating water-rich fruits and vegetables into your diet. Avoiding prolonged sitting, especially on the toilet, can also help prevent hemorrhoids. If you experience constipation, try not to strain during bowel movements, as this can worsen hemorrhoids. Instead, get up and move around or try using a stool softener or laxative as directed by your doctor. Disclaimer: the information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Section 7. Finding relief and moving forward. Hemorrhoids are a common and often uncomfortable condition, but they are treatable. By understanding the causes, recognizing the symptoms, and seeking timely medical attention, you can find relief and prevent future occurrences. Remember, you don't have to suffer in silence. Conservative management techniques such as increasing fiber intake, staying hydrated, and practicing good bathroom habits can effectively manage many cases. For more severe cases, medical interventions offer safe and effective solutions. With the right approach, you can find relief from hemorrhoid symptoms and improve your quality of life. If you are experiencing any of the symptoms mentioned earlier, don't hesitate to schedule an appointment with your doctor. They can help determine the best course of treatment for your individual needs and provide guidance on how to prevent future occurrences. Remember, your health is worth it.